Question 1. A patient presents to the clinic with a chief complaint of fever and cough. The physician documents acute bronchitis due to respiratory syncytial virus, RSV. How would you code this encounter? A. J20.9, B 97.4. B. B 97.4, J20.9. C. J20.5. D. J20.9. Answer, C. J20.5. This question tests your knowledge of combination codes in ICD 10-CM. The documentation clearly states the cause of the acute bronchitis is RSV, and looking up bronchitis, J20 leads you to a specific code, J20.5, which includes acute bronchitis due to respiratory syncytial virus. This is a combination code that fully describes both the condition and its cause, so you only need this single code. Remember, if a code exists that describes both the condition and the associated organism or cause, use that combination code. Question 2. A patient fell off a ladder at home and sustained a fractured wrist. What is the appropriate place of occurrence code? A. Y92.00. B. Y92.009. C. Y92.000. D. Y92.9. Answer, C. Y92.000. This question asks about place of occurrence codes, which are used with external cause codes to describe where an injury happened. The keyword here is at home, specifically a single-family house. Looking up place of occurrence codes under Y92 leads you to categories for specific locations. Y92.000 is the code for single-family house as the place of occurrence, providing the most specific detail about where the fall occurred. Place of occurrence codes add valuable data about injury circumstances. Question 3. A patient is admitted for chemotherapy for lung cancer. The lung cancer is metastatic from the colon. Which code is sequenced first? A. C78.00. B. C18.9. C. Z51.11. D. C34.90. Answer, C. Z51.11. This scenario involves coding for treatment of a malignancy. The keyword is chemotherapy, indicating the reason for the encounter is treatment, not diagnosis or excision of the tumor itself. When a patient is admitted solely for chemotherapy, the Z code for chemotherapy, Z51.11, is always sequenced as the principal diagnosis. The malignancy codes are then listed as secondary diagnoses to indicate what is being treated. Question 4. A patient has been diagnosed with both type 2 diabetes mellitus and diabetic polyneuropathy. How should these conditions be coded and sequenced? A. E11.42, E11.9. B. E11.9, E11.42. C. E11.42. D. G63. Answer, C. E11.42. This question tests your understanding of combination codes for diabetes with complications. The patient has type 2 diabetes and a specific complication, polyneuropathy. In ICD-10-CM, many diabetes complications are included in combination codes found in the E11 category for type 2 diabetes. E11.42 specifically represents type 2 diabetes mellitus with diabetic polyneuropathy, so this single code captures both conditions. Always check for available combination codes when coding diabetes with documented complications. Question 5. A patient presents for a follow-up visit after a fracture treatment that has healed. The purpose is to check the healing status. What is the appropriate Z code for this encounter? A. Z09. B. Z47.89. C. Z08. D. Z04.81. Answer: B. Z47.89. This question is about using Z codes for follow-up care after injury treatment. The key phrase is follow-up visit after a fracture treatment that has healed, and the purpose is to check the healing status. Looking at the Z codes, Z47 is for orthopedic aftercare. Z47.89 is specifically for other orthopedic aftercare, which includes visits for checking the healing of a resolved fracture. Z codes are essential for describing reasons for encounters other than active illness. Question 6. A patient has chronic kidney disease stage 3 and hypertension. The physician documents hypertensive chronic kidney disease, CKD, stage 3. How should these conditions be coded? A. I10, N18.3. B. N18.3, I10. C. I12.9, N18.3. D. I12.9. Answer: D. I12.9. This question involves coding hypertension and chronic kidney disease when a causal relationship is documented. The documentation explicitly states hypertensive chronic kidney disease, indicating the hypertension caused the CKD. ICD-10-CM provides combination codes for this relationship in category I12. I12.9 is for hypertensive chronic kidney disease with stage 1 through stage 4 chronic kidney disease, or unspecified chronic kidney disease, which covers stage 3 in this case. Use the combination code when the link is documented. Question 7. A patient is diagnosed with cellulitis of the right arm due to MRSA. How would you code this? A. L03.113, B95.62. B. B95.62, L03.113. C. L03.113, Z16.11. D. L03.113. Answer: A. L03.113, B95.62. This question requires coding an infection caused by a specific resistant organism. The diagnosis is cellulitis of the right arm, and the cause is MRSA. While the cellulitis has a specific code, L03.113 for cellulitis of the right upper limb, ICD-10-CM guidelines instruct you to also code the MRSA infection, B95.62, as an additional diagnosis to fully describe the etiology. Code the condition first, then the organism if specific instructions or guidelines apply. Question 8. A patient was seen in the emergency department after being struck by a car while crossing the street, pedestrian. What is the correct external cause code assignment? A. V03.10XA. B. V03.00XA. C. V09.9XXA. D. W21.XXXA. Answer: A. V03.10XA. This question focuses on external cause codes, specifically for pedestrian transport accidents. The keyword is struck by a car while crossing the street, pedestrian. Category V03 in ICD-10-CM is for pedestrian injured in collision with car, pickup truck or van. V03.10 refers to pedestrian on foot injured in collision with car, pickup truck or van, initial encounter. External cause codes require a seventh character, A is used for the initial encounter for the injury. These codes provide crucial data on how injuries happen. Question 9. A patient presents with acute pain due to a herniated lumbar disc. The physician documents acute low back pain due to lumbar disc herniation. How is the pain coded? A. M51.26, G89.11. B. G89.11, M51.26. C. M54.5. D. M51.26. Answer: A. M51.26, G89.11. This question addresses coding pain related to a specific condition. The diagnosis is acute low back pain due to lumbar disc herniation. While M51.26 codes the herniated lumbar disc, the patient also has documented acute pain. When pain is clearly associated with a specific site or condition documented by the provider, and the acuity is specified, you should code both the underlying condition and the acute pain code G89.11 for acute pain, not elsewhere classified. Code the condition first, then the pain code, unless guidelines say otherwise. Question 10. A patient is diagnosed with pneumonia and sepsis. The physician documents sepsis due to Streptococcus pneumoniae with septic shock and pneumonia. How should these conditions be coded? A. R65.20, J18.9. B. A40.3, R65.21, J13. C. J13, R65.21, A40.3. D. R65.21, A40.3, J13. Answer: B. A40.3, R65.21, J13. This complex scenario involves sepsis, septic shock, and a localized infection, pneumonia, with a specific organism. The physician clearly links the sepsis to Streptococcus pneumoniae. ICD-10-CM guidelines for sepsis require coding the systemic infection code first, then the severe sepsis code if applicable, and then the code for the localized infection. A40.3 is the code for sepsis due to Streptococcus pneumoniae, R65.21 is for severe sepsis with septic shock, and J13 is for pneumonia due to Streptococcus pneumoniae. Code the specific sepsis code first, then severe sepsis if present, then the associated localized infection. Question 11. A patient had a stroke 3 years ago and now has residual right-sided hemiplegia, paralysis. The patient is being seen for the hemiplegia. How should this be coded? A. I63.9, G81.94. B. G81.94, I69.359. C. G81.94. D. I69.359, G81.94. Answer: B. G81.94, I69.359. This scenario involves coding a sequela, which is a residual condition remaining after the acute phase of an illness or injury has terminated. The patient's hemiplegia is a direct result of a stroke that occurred in the past, 3 years ago, making it a sequela. According to ICD-10-CM guidelines for sequelae, the residual condition, hemiplegia, G81.94, is typically coded first, followed by the code for the sequela of the cause, sequelae of cerebrovascular disease, I69.359. Code the residual condition first, then the code indicating the cause of the sequela. Question 12. A patient presents for a follow-up visit after a fracture treatment that has healed. The purpose is to check the healing status. What is the appropriate Z code for this encounter? A. Z09. B. Z47.89. C. Z08. D. Z04.81. Answer: B. Z47.89. This question is about using Z codes for follow-up care after injury treatment. The key phrase is follow-up visit after a fracture treatment that has healed, and the purpose is to check the healing status. Looking at the Z codes, Z47 is for orthopedic aftercare. Z47.89 is specifically for other orthopedic aftercare, which includes visits for checking the healing of a resolved fracture. Z codes are essential for describing reasons for encounters other than active illness. Question 13. A patient presents with symptoms of chest pain. After evaluation, the physician diagnoses unstable angina pectoris. How is this coded? A. I20.0. B. I25.10. C. R07.4. D. I21.4. Answer: A. I20.0. This question asks for the code for unstable angina pectoris, which is a type of chest pain indicating potential heart issues. While the patient presented with chest pain, R07.4, the physician provided a definitive diagnosis, unstable angina pectoris. In coding, you always code the definitive diagnosis when it is established, rather than just the symptom. I20.0 is the specific code for unstable angina. Code the confirmed diagnosis, not just the symptom that led to it. Question 14. A patient is diagnosed with malignant neoplasm of the lower lobe, primary, of the left lung. How is this coded? A. C34.32. B. C34.30. C. C34.12. D. C34.10. Answer: A. C34.32. This question requires coding a primary malignant neoplasm of a specific site within the lung, including laterality. The diagnosis specifies lower lobe, primary, of the left lung. Category C34 codes for malignant neoplasm of the bronchus and lung. C34.3 is for the lower lobe, and the fifth character indicates laterality, 2 for left. Therefore, C34.32 is the correct code. Always ensure you code to the highest level of specificity provided in the documentation, including laterality if applicable. Question 15. A patient presents for a routine general medical examination. No abnormalities are found. What is the appropriate Z code? A. Z00.00. B. Z00.01. C. Z01.89. D. Z02.89. Answer: A. Z00.00. This question asks for the code for a routine physical exam when the findings are normal. The term routine general medical examination is key. Z00.00 is the specific ICD 10 cm code for encounter for general adult medical examination without abnormal findings. Z codes are used when the reason for the encounter is not a current illness or injury, such as for preventive services or evaluations. Use Z00.00 for a checkup with no issues found. Question 16. A patient has carcinoma of the tail of the pancreas with metastasis to the liver. How is this coded? A. C25.2, C78.8. B. C78.8, C25.2. C. C25.2. D. C78.8. Answer: A. C25.2, C78.8. This question involves coding a primary malignancy with metastasis to a secondary site. The carcinoma of the tail of the pancreas is the primary site, and the metastasis to the liver is the secondary site. According to coding guidelines for neoplasms, the primary malignancy is typically coded first, followed by the code for the secondary malignancy. C25.2 is the code for malignant neoplasm of the tail of the pancreas, and C78.8 is for secondary malignant neoplasm of other specified digestive organs, including the liver. Always code the primary first, then any secondary sites. Question 17. A patient is diagnosed with acute and chronic sinusitis. Both conditions are present during the same encounter. How is this coded? A. J01.90, J32.9. B. J32.9, J01.90. C. J01.90. D. J32.9. Answer: A. J01.90, J32.9. This question addresses coding both acute and chronic forms of the same condition. When a patient has both acute and chronic versions of an illness, and there is no specific combination code, you should code both conditions. J01.90 is the code for acute sinusitis, unspecified, and J32.9 is the code for chronic sinusitis, unspecified. Code both conditions separately to fully capture the patient's status. Question 18. A patient has a fracture of the shaft of the tibia due to a fall. The patient is seen for initial treatment in the emergency department. What is the appropriate seventh character for the fracture code? A, B, D, C, G, D, S. Answer: A. This question focuses on the seventh character required for injury codes, specifically fractures. The patient is seen for initial treatment of the fracture in the emergency department. The seventh character is used for the initial encounter for a fracture, meaning the patient is receiving active treatment for the injury. The seventh character provides crucial information about the phase of care for injuries. Question 19. A patient is diagnosed with gastritis due to H. pylori. How is this coded? A. K29.70, B96.81. B. B96.81, K29.70. C. K29.70. D. K29.71. Answer: A. K29.70, B96.81. This question involves coding a condition caused by a specific bacterium. The diagnosis is gastritis due to H. pylori. K29.70 is the code for gastritis, unspecified. While there isn't a combination code for gastritis due to H. pylori, ICD 10-CM guidelines instruct you to also code the responsible organism when it is documented. B96.81 is the code for Helicobacter pylori, H. pylori, as the cause of diseases classified elsewhere. Code the condition first, then the organism. Question 20. A patient fell downstairs at their home. What is the appropriate external cause code? A. W10.9XXA. B. W10.8XXA. C. W10.2XXA. D. W10.0XXA. Answer: A. W10.9XXA. This question asks for the external cause code for falling downstairs. The mechanism of injury is a fall, specifically downstairs. W10 in ICD 10-CM is the category for fall on and from stairs and steps. W10.9 is for fall on and from stairs and steps, unspecified. Adding the seventh character for the initial encounter results in W10.9XXA. External cause codes document how an injury occurred. Question 21. A patient is diagnosed with COVID-19. The documentation states suspected COVID-19. How is this coded? A. U07.1. B. Z20.828. C. R50.9. D. Code the signs and symptoms. Answer: D. Code the signs and symptoms. This question tests your understanding of coding suspected conditions in ICD-10-CM. The documentation clearly states suspected COVID-19. In the outpatient setting, you should not code a diagnosis listed as suspected, probable, or rule out. Instead, you code the patient's signs and symptoms that led the physician to suspect the condition. Only code a confirmed diagnosis in the outpatient setting. Question 22. A patient has a history of myocardial infarction, MI, that occurred several years ago. The patient has no current symptoms related to the MI and is being seen for an unrelated issue. How is the history of MI coded? A. I21.3. B. I25.2. C. Z86.73. D. Z86.79. Answer: C. Z86.73. This question asks about coding a personal history of a past illness that is no longer current. The patient had an MI several years ago and has no current symptoms. Z codes are used for personal history when the condition is no longer present and is not receiving treatment. Z86.73 is the specific code for personal history of myocardial infarction. Use a Z code for history of a resolved condition. Question 23. A patient presents for screening colonoscopy due to a family history of colon cancer. The procedure is routine and no abnormalities are found. What is the primary code? A. Z12.11. B. Z80.0. C. Z12.12. D. K63.5. Answer: A. Z12.11. This question involves coding for screening examinations. The patient is undergoing a screening colonoscopy because of a family history of colon cancer. Z codes are used for screening encounters. Z12.11 is the code for encounter for screening for malignant neoplasm of colon. The reason for the screening is the primary code. The family history, Z80.0, would be a secondary code if relevant for the encounter. Code the reason for the screening first. Question 24. A patient presents with a painful swollen joint diagnosed as acute gout. How is this coded? A. M10.00. B. M10.069. C. M1A.00. D. M1A.069. Answer: B. M10.069. This question asks for the code for acute gout. The documentation specifies acute gout affecting a painful swollen joint, but does not specify the location. M10.0 is the category for idiopathic gout, acute. The 5th and 6th characters indicate the site, and 69 is for multiple sites or unspecified site. Adding the 7th character 0, not applicable for this category, and the unspecified site 69 results in M10.069. Code to the highest level of specificity documented. Question 25. A patient is diagnosed with hypothyroidism due to a surgical removal of the thyroid gland, thyroidectomy. How is this coded? A. E03.9, Z90.3. B. E89.0. C. E03.0. D. Z90.3, E89.0. Answer B. E89.0. This question involves coding a post-procedural endocrine disorder. The patient has hypothyroidism, low thyroid function, that occurred specifically because the thyroid gland was surgically removed. ICD-10-CM has specific codes for post-procedural endocrine and metabolic disorders in Chapter 4, E00E89, specifically Category E89 for post-procedural endocrine and metabolic disorders. E89.0 is the code for post-procedural hypothyroidism. Use the specific post-procedural code when a condition is a direct result of a medical procedure.